They say skin cancer is the good cancer. The one you shouldn't worry about. Really? Tell that to the man who thought the spot on his nose was just a scar from too much sun, and woke up one morning to find surgeons had carved away a piece of his face. Good cancer? Stop scrolling and let's talk about the cancer that hides in plain sight, the one your doctor might dismiss as just cosmetic, the one that is quietly rewriting the story of thousands of lives. His name was Daniel Mercer. Not a celebrity chef, not a TV star, just a 49-year-old father of two who believed his body was invincible because he exercised, ate organic, and never smoked a day in his life. Yet, for 3 years, a small pearly bump on the edge of his nose became his silent stalker. At first, it bled when he shaved. Then it crusted over and healed. Then it bled again. He joked with his wife that it was his battle scar from the sun. She begged him to see a dermatologist. He laughed it off. Do you see the problem already? Most people think skin cancer looks dramatic, ugly, or life-threatening. The truth? Basal cell carcinoma, the most common skin cancer in the world, is boring. Quiet. It does not scream. It whispers. And because of that, it kills not with speed but with neglect. When Daniel finally went to see a doctor, he was given a 5-minute exam. The physician glanced at the bump and said, "It's probably nothing. Could be a mole, could be scar tissue. You're young, don't worry." That one sentence cost him 2 years. Let me stop here and teach you something his doctor didn't. When a lesion on your skin doesn't heal after 3 weeks, whether it bleeds, scabs, or just sits there, don't accept "it's nothing" as an answer. Basal cell carcinoma doesn't follow the Hollywood script of cancer. It rarely metastasizes. Instead, it burrows, digging deeper into skin, cartilage, even bone. It disfigures. It erases. Daniel ignored it until one evening his daughter looked at him and said, "Dad, your nose looks like it's melting." That night, in the bathroom mirror under harsh fluorescent light, he finally saw what others saw. The bump was bigger, shinier, stretched thin like wet tissue paper ready to tear. The shock was not that it had grown, but that he had become blind to it. You see, this is how denial works in medicine. Not just for patients but for the doctors who see them. A busy clinic, a 5-minute visit, a distracted doctor. And a dangerous story is written in silence. Daniel returned, this time to a different physician. A biopsy was taken. Days later, the phone call, "You have basal cell carcinoma." He almost laughed. Cancer? He didn't feel sick. He wasn't losing weight. He wasn't fatigued. How could it be cancer when he was running half marathons? Here's the truth no one tells you. Cancer doesn't care about your gym membership. It doesn't care about your diet. It cares only about opportunity. And the sun, the one we worship for its warmth and light, gave Daniel all the opportunity in the world. Years of beach trips without sunscreen, golf games under blazing skies, and the smug belief that it'll never happen to me. But here's the kicker. When basal cell carcinoma finally demands to be removed, it doesn't ask politely. The surgeon explained the procedure in clinical terms. We'll need to excise the lesion, possibly use a flap of skin from your cheek to reconstruct the area. What Daniel heard was, "We're going to carve away part of your face." And he was right. This is the moment most people never prepare for. We talk endlessly about heart disease, strokes, diabetes. But what about the cancer that steals your appearance, your identity, the way you look in the mirror? We dismiss it as cosmetic, but to the patient, it is life-altering. The morning of surgery, Daniel sat in a freezing hospital gown, his hands trembling. His wife held his hand. He remembered every sunburn he had as a teenager, every time he ignored sunscreen because it made him greasy. Each careless moment replayed like a confession. He whispered, "I did this to myself." And here's the teaching moment I need you to remember. Guilt is the cruelest side effect of preventable disease. Patients carry it like a second scar. Yes, UV exposure causes 90% of basal cell carcinomas, but no one deserves cancer. Not the sun worshipper, not the shade seeker, not anyone. The system fails us when prevention education is whispered instead of shouted. Daniel's surgery took 3 hours. When he awoke, half his nose was gone, replaced with stitched skin pulled from his cheek. The mirror was a battlefield. His daughter, brave as ever, kissed his forehead and said, "You're still Dad." But Daniel didn't feel like Dad. He felt like a stranger. Do you think the story ends here with survival? No. This is only the first chapter. Because basal cell carcinoma isn't a one-time visitor. Once you've had one, the chances of another skyrocket. Patients enter a lifetime of vigilance. Dermatology checkups every 6 months, anxiety every time a new spot appears, the lingering fear of disfigurement again. And this is where the system betrays patients the most. Insurance companies often downplay dermatology exams as elective, cosmetic, optional. But what happens when optional becomes life-saving? Daniel fought his insurer for coverage of his reconstructive surgery. He was told his procedure was not medically necessary. Imagine being told your face isn't medically necessary. This is why I'm telling you this story. Not to scare you but to arm you. Because the medical world is full of biases. Bias against what looks cosmetic, bias against those who look too healthy to be sick, bias that punishes people for being unlucky. Daniel became an activist, though he never planned to. He began speaking at local schools, showing students the scar on his face, telling them sunscreen isn't about vanity, it's about survival. He learned what too many people never do. Scars are stories, and silence is deadly. And here's where I leave you with a thought, a question that should burn as much as the summer sun. If a disease doesn't kill you but takes away your face, your confidence, your identity, how do you survive it? Do you think our healthcare system should treat appearance as medical necessity, or as luxury? Drop your answer in the comments. Hit the subscribe button now. What if I told you that surviving cancer once doesn't mean you're safe? That the real danger is waiting quietly, invisible, and ready to strike again? And sometimes, it's not the disease but the system itself that threatens your survival? Daniel Mercer thought he had learned his lesson. He had fought basal cell carcinoma, faced the surgical blade, and lived to tell the story. But the truth is, cancer never truly leaves you. It lingers in whispers, in shadows, in the moments when a new blemish appears and your heartbeat quickens. 6 months after his surgery, Daniel was at a routine dermatology follow-up. The doctor's office smelled faintly of antiseptic, the air conditioned to a cold, clinical chill. Daniel sat nervously, touching the healed skin on his nose. The scar was pale now, but he noticed a small shiny bump near his temple, a place he hadn't considered. The dermatologist frowned. "We should biopsy this," she said. Daniel felt his stomach twist. Not again. He remembered the first time, the denial, the guilt, the terror. The procedure was quick, but the waiting for results felt eternal. When the call came, Daniel's world tilted. Another basal cell carcinoma. This time, the lesion was deeper, more aggressive, and located dangerously close to his eye. He was instructed to schedule surgery immediately. But this time, the system seemed less cooperative. Insurance approval was delayed. "We need more documentation," the representative said. Daniel felt the frustration rising like bile. How many lives are jeopardized because red tape moves slower than disease? Hospitals are machines, not allies. Doctors may care, but bureaucracy doesn't. And every day that delay lasted, the cancer was burrowing further. Here's a shocking truth few patients realize. Basal cell carcinoma rarely kills, yes, but it can destroy, deform, and terrorize. The real danger is disfigurement, especially on the face. Daniel understood something he hadn't before. His identity was on the line, not just his life. During this stressful period, Daniel began to notice subtle bias creeping in. The nurse who greeted him at one hospital assumed he was too healthy to be worried, questioning whether he even needed surgery. Another doctor asked if he was a sun worshipper, in a tone that implied blame. These microaggressions, subtle as they seemed, were a cruel echo of the way healthcare often dismisses patients who don't fit the stereotypical sick mold. Let's pause here for a lesson that can save your life. Never let assumptions guide your care. Insist on biopsies. Insist on follow-ups. Advocate for yourself like your life depends on it, because sometimes it does. Daniel's surgery for the second lesion was more complex. The tumor had spread under the skin, and the surgeon warned that reconstructing the area might require multiple procedures. He spent that night awake, thinking about how easily this could have been prevented. Sunscreen, annual skin checks, taking that first dermatologist's warning seriously. Small actions with massive consequences. As he recovered, Daniel began journaling every appointment, every interaction, every instance of dismissal or oversight. He realized the system wasn't just imperfect, it was negligent. Too many patients had their cancers ignored, delayed, or trivialized, especially if the tumor didn't look scary enough or the patient seemed healthy. Daniel's story also revealed another hidden risk: the emotional toll. Fear, anxiety, guilt, and anger became daily companions. He couldn't sleep without checking his mirror, couldn't walk under sunlight without obsessing about UV exposure, and every new mole sent his pulse racing. This psychological burden is rarely discussed, yet it is a defining feature of survivors. Then came the day that shocked him to the core. A post-surgical check revealed irregular cells at the edge of his reconstruction site. The tumor had returned, not just in the original spot, but creeping along the cartilage beneath his nose. The surgeon called it a recurrence, the word heavy with unspoken horror. This moment was not just medical. It was personal. Daniel faced a terrifying realization. He might never be free of this disease. Every scar would remind him of vulnerability, every new bump a potential threat. He had entered a lifetime contract with cancer, a contract he hadn't signed but could not escape. Yet, amidst the fear, Daniel discovered a radical truth. Knowledge is power. He started learning everything about skin cancer: basal cell carcinoma, squamous cell carcinoma, melanoma, the types, the warning signs, the preventive measures. He learned that UV exposure is cumulative, that sunscreen is not optional, and that dermatology visits are life insurance in disguise. And he learned something else. Patients who educate themselves become harder to dismiss. Doctors cannot easily ignore a patient who knows the risks, the terminology, and the evidence. Advocacy is not just a strategy. It is armor. But just when Daniel thought he was learning to control his fear, a shocking medical revelation changed everything. The biopsy of his new lesion revealed not only basal cell carcinoma, but also early signs of an aggressive squamous cell carcinoma developing nearby. 2 different skin cancers. 2 different threats. 1 body. This is the part most people don't see coming. Cancer doesn't respect fairness, experience, or preparation. It doesn't play by your rules. And sometimes, survival is about timing, persistence, and sheer stubbornness. Daniel stared at the hospital ceiling that night, tracing the lines of fluorescent light as if they were a map of his own fate. He realized that the fight wasn't just against cancer, but against a system that treated prevention as optional, seriousness as negotiable, and patients as passive participants rather than active advocates. Here's the takeaway. Awareness isn't enough. Action is required. Check your skin monthly. Document new lesions. Seek second opinions. Demand biopsies. Protect your children, your friends, and yourself. Because the difference between a small scar and life-altering disfigurement may come down to a single visit you choose not to delay. Daniel's journey, however, was far from over. He had survived 2 rounds of surgery, battled insurance bureaucracy, endured bias, and confronted the physical and emotional scars of basal cell carcinoma. But the recurrence, coupled with the discovery of a second skin cancer type, raised a chilling question. Could the very system designed to protect him now fail him completely? And here's the cliffhanger for you to think about. If a patient faces recurring cancers and a healthcare system that dismisses early warning signs, whose responsibility is it to ensure survival? The patient, the doctor, or the system itself? Drop your thoughts in the comments below. How far should patients go to advocate for themselves when the system seems stacked against them? Subscribe to whitecoatsecrets channel now. Imagine looking in the mirror and not recognizing yourself. Not because you've aged, not because of time, but because your own body has betrayed you. Imagine fighting a disease that hides in plain sight, sneaks past doctors, and leaves scars that no one notices except you. This was Daniel Mercer's reality. The night after his 3rd biopsy revealed not just basal cell carcinoma, but early squamous cell carcinoma in the same region of his face, Daniel lay awake, staring at the hospital ceiling. He thought about his children, his wife, his life before the disease. The thought that terrorized him most wasn't death, it was invisibility. The disease had crept into his life quietly, and the system had almost ignored it. Daniel's surgeon arrived the next morning with an urgency that made the words stick in his throat. "We need to act fast," she said. "This is more aggressive than we first thought. We're going to perform Mohs surgery. It will remove cancer cell by cell, and we'll reconstruct as much as we can, but this will be intensive." For those listening, Mohs surgery is the gold standard for high-risk skin cancers on the face. It's precise, painstaking, and often life-changing. Daniel didn't know that before, but now he would experience it firsthand. The procedure lasted hours. Daniel watched, or rather felt, every careful cut, every stitch, every movement. The surgeon explained each step, a blend of science and artistry. And then, something shocking emerged. The squamous cell carcinoma had spread further under the skin than imaging had revealed. If it had been left unchecked even a few more weeks, it could have invaded bone or eye tissue. This is the moment most patients never see coming. The danger is not always on the surface. Cancer can hide, silently eroding, waiting for attention. And even when patients advocate for themselves, they are still vulnerable to the subtle failures of the system. Daniel survived the surgery, but the aftermath was more than physical. The reconstruction had left a complex scar across his nose and cheek, a roadmap of the battle he had endured. He would never look the same, but in a paradoxical way, he had been given a second chance. Yet the fight had opened his eyes to deeper truths about healthcare, prevention, and bias. He began to study hospital policies, dermatology protocols, and preventive care measures. He discovered that too many patients are dismissed because their cancer doesn't look dangerous, or because they are healthy. He learned that skin cancer is the most common, yet most under-discussed, cancer in the world. Most people survive, yes, but only if detected early, only if treated aggressively, and only if patients advocate for themselves relentlessly. Daniel's experience revealed something even more shocking. Implicit bias in medical care is real. Doctors, nurses, and insurers sometimes assume that patients who appear healthy or well-off are at lower risk, or that cosmetic procedures are non-essential. Patients like Daniel, who exercised, ate well, and maintained a polished appearance, were assumed to be safe. These assumptions almost cost him his face, his confidence, and his peace of mind. Here's a lesson you can take home. Don't trust assumptions about your health. Every lesion, every bump, every unexplained change deserves attention. Trust your instincts. Document everything. Insist on proper evaluations. And don't let shame, embarrassment, or fear stop you from demanding care. Daniel became a voice for awareness. He started giving talks at schools and community centers, showing his scars and sharing the lessons no one else talks about. Sunscreen, he explained, was not about vanity. It was about life. Early detection, he insisted, was not about paranoia. It was about survival. And advocacy, he reminded, was not optional. It was armor. But even with awareness, Daniel faced a question that kept him awake. What about those who don't have a voice? The system is stacked against people who can't fight back, who are dismissed because of age, race, income, or even appearance. The thought haunted him. Survival wasn't just a personal fight, it was a societal responsibility. Then came the night that changed everything. Daniel received a call from the surgeon's office. A new lesion had been found, smaller this time, subtle, but it was enough to trigger alarm. The realization hit him like a physical blow. Cancer wasn't done with him yet. Even with advocacy, even with knowledge, he remained vulnerable. This is where most stories end in cliché, with "he survived" or "the cancer was gone." But the truth is messier. Survival is ongoing, vigilance is relentless, and the emotional scars often run deeper than the physical. Daniel had learned to live with uncertainty, to navigate the complex web of bias, insurance, and medical oversight, and to educate those around him before tragedy struck. Here's a final shocking reveal. The most dangerous aspect of skin cancer is not just the disease itself. It is how society, medicine, and bureaucracy treat it as a problem only when it becomes visible or urgent. Prevention, early detection, and patient advocacy are the real weapons. And sadly, too many patients never get the chance to wield them effectively. So Daniel's story ends not with a perfect face or a clean bill of health, but with awareness, action, and a choice. To let fear control him, or to turn his scars into lessons for everyone else. And now I leave you with the question that has haunted every patient like Daniel. If a disease quietly erodes your health and the system seems indifferent, how far would you go to protect yourself? Would you fight for early detection, demand accountability, and challenge bias, even when no one else is watching? Drop your answer in the comments. Let us know how you would act if you were in Daniel's shoes. If you want more stories like this, real patients, shocking medical neglect, hidden biases, and practical health advice, subscribe to White Coat Secrets. The truth is often stranger than fiction, and the lessons are always life-saving. Because the next time you see a tiny bump, a mole, or a scar, you may just remember Daniel Mercer, And realize that vigilance isn't just precaution, it's survival.